All right, let's go ahead and get things kicked off here. So thank you so much for joining us this morning. My name is Cameron Hilt, and I serve as the program director for the Upper Midwest Telehealth Resource Center. And today we're going to be talking a little bit about remote patient monitoring and chronic care management, so RPM and CCM, and ultimately treating patients in their homes. So I want to disclaim first that this presentation was made in partnership with the Ohio Department of Health. So this project is supported by the Health Resources and Services Administration and the U.S. Department of Health and Human Services as part of an award totaling over $10 million with 0% percentage financed with non-governmental sources. And the contents of this is the authors and does not necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the US government. So just a little bit about us. So first, so as I mentioned, I'm with the Upper Midwest Telehealth Resource Center. We are a program of the Indiana Rural Health Association, which is focused on improving the health and well-being of rural Hoosiers across the state of Indiana. However, the Upper Midwest Telehealth Resource Center is a regional telehealth resource center. So we work with the states of Indiana, Ohio, Michigan, Illinois. And really what we're meant to be is a one-stop shop for all things related to telehealth. So we provide free individual consultation, technical assistance, connections with other programs, project assessments, as well as updates on reimbursement, policy, and legislative updates. Specifically within telehealth, we know it's difficult to track all of the changes on that front. So we do our best to make sure that we can bring the most up-to-date information to you. We also provide a variety of presentations and training. So we host a monthly webinar series based off of a variety of different topics. We host a virtual view podcast, which is where we talk about telehealth related topics on a bi-monthly basis. We also host a virtual office hour. This is done once a month and is an open Q&A for any telehealth related questions that you have. So you can hop on, ask any questions that you have related to telehealth with the UMTRC team. And then we also host telehealth workshops, telehealth trainings, such as ones that you are participating today, and a demonstration center. There's a variety of different ways that you can connect with us. We have our website where we host all of our different events, a ton of different resources related to telehealth. We have patient and provider resources located on there, as well as I already mentioned, our podcast. We do also host a YouTube channel where we will post some of our training content, as well as active on Facebook, Twitter, and LinkedIn, where we post different updates related to telehealth that are coming up. One thing I did want to mention is coming up in September, the 13th through the 14th, we do have our 4th annual telehealth conference. And so if you or any individuals at your organization are interested in going to a conference specifically devoted to telehealth and technology, really, this is meant to bring those resources closer to home to you. This is located in South Bend, Indiana. As I mentioned, we're a regional telehealth resource center. This was about as central as we could get between the 4 states that we serve. And so this is now live. We have our speaker lineup already set, as well as attendee and exhibitor registration is now open. So if you want any more details, you can sign up on our website. The main focuses of our keynote speakers are going to be specific to policy and workforce. So that's just a little bit about our annual conference that's coming up in September. But now moving into the content for today. So when it comes, these are really the objectives of this presentation. So first, we're going to make a distinction between RPM and CCM. What are they? What are similarities? What are some of the reasons that these two services are often utilized together? So first, starting off with some of the differences. So remote patient monitoring, again, that stands shorthand is RPM, has multiple purposes, which can include chronic care management, principal care management, which is just focusing on one chronic condition, acute care, neonatal care, et cetera. Chronic care management, on the other hand, has only one purpose, and that's to manage the care of patients with 2 or more chronic conditions as designated by the Centers for Medicare and Medicaid Services. So remote patient monitoring, you have more opportunities to engage those patients in RPM, regardless if if it's more of an acute case or maybe they only have one chronic condition. Whereas chronic care management is specifically for some of those more complex patients. When it comes to the complexity of the cases, again, RPM, when it comes to the billing and reimbursement, we'll get to that much later in the presentation. RPM does not distinguish between medium to high complexity cases for patients. Additionally, chronic care management does. So it has separate code sets for non-complex patients, as well as for medium to high complexity cases. So that's an additional difference between the two. Expectations when it comes to 24 access to care, that is not something included in remote patient monitoring, but it is in chronic care management. The possibilities of billing increments also changes too. For remote patient monitoring, predominantly you're billing in increments of 20 minutes. For chronic care management, you can do increments of 20, but if you're looking at those medium to high complexity cases, that's when you're encouraged to bill at about 60 minutes monthly. Additionally, the care activities are going to be different between the two. RPM is going to be focused on that interpretation of the received data and interactions with patients to create a treatment plan. Whereas chronic care management is going to be lots of different aspects. So care coordination, medication reconciliation, oversight of patient self-management, and much, much more that's going to be included in those CCM services. Some of the ways that these two services are similar is that staff involved are similar amongst the two. Now, this may vary from state to state, but predominantly physicians, qualified health professionals, and clinical staff are allowed to engage in those services. The billing cycle for both is going to be on a monthly basis. Patient consent is required for both services. And for the location of the patients, these are both done at a distance. It's anywhere outside of the hospital. It does not have to be at an originating site to provide those services. So that kind of begs the question of why do you utilize these two services together? And so for RPM and CCM, what it does is it gives you an opportunity to provide more proactive care for your patients. So when you are getting consistent data feeds and you're able to use that to inform the chronic care management that you're providing for a patient, it gives you a lot more data on a much more consistent basis than if you're having a patient come in consistently for a blood draw, for them to step on a weight scale, to get a blood pressure reading. So it gives you an opportunity to provide more proactive care when you see measurements perhaps spike in a negative direction versus having to wait for them to come into the office to receive that care. An additional benefit is that both can be billed in the same month, which helps improve reimbursement opportunities for the services. And these are deemed as complementary services with the Centers for Medicare and Medicaid Services. So that can improve some reimbursement opportunities if you are providing both of the services at the same time, since they do complement each other well. And then lastly, it gives more objective insight and day-to-day management of a patient's condition and improves patient satisfaction. We'll talk about this a little bit more when we go through some case studies, but it helps with the education for a patient. They can see how their daily choices are impacting their conditions when they are having these consistent readings done, as well as the consistent follow-up, either through the RPM or CCM program that they're enrolled in. Which can help improve the patient's satisfaction because they feel like more proactive care is being done. They're not having to come into the office as frequently. And so that can improve the patient's perception and satisfaction with the care that's being provided to them as well. So now I want to take some time looking at some outcomes. We'll look at some more general outcomes. I'm kind of picked some different snippets from a variety of different chronic conditions so you could see what it looks like as well as some different measures that were looked at to show the impact of the programs, but also spend a little bit of time specific on maternal health and how does RPM and CCM help patients who are receiving maternal health care. I did want to mention that for this particular part of the presentation, I did reference vendors. This is in order to understand the RPM and CCM capabilities and technology that are currently on the market. The pictured vendors were referenced. We at the UMTRC, we are vendor agnostic. So we do not endorse any of these vendors. These are only being shown for demonstration purposes. So I wanted to preface that. But I wanted to look at a few different case studies. So this first is looking at the UMMC's Mississippi's Diabetes Telehealth Network. So this is where they looked after the first year of implementation of an RPM program. They found that of the 100 patients who were engaged in the program, that those patients had 0 hospitalizations and ER visits in that 1 year period. Those patients saw an average A1C reduction of about 1.7%. And there was a total annual cost savings of over $300,000 for those 100 patients engaged. So as we read through some of these different case studies, I want you just to kind of look at, what are some of the biggest chronic conditions that are a problem within your patient population, and what are some of the things that you would hope to get out of an RPM program. So through these different case studies, hopefully that will connect some of the dots of, other individuals that have implemented the program and some of the outcomes they saw. So if you're looking, you want to engage patients with diabetes, and you're looking at these particular measures, it could mean that an RPM program could be a good fit for you. Moving on to another case study, this was an RPM solution that was implemented at a children's hospital in Virginia, at the Virginia Commonwealth University Health. And what they saw is that of the patients that were engaged in the RPM program, there's improvement in early discharge from the inpatient setting of 12 to 24 hours. There was 0 unplanned returns to the hospital. They saw that 92% of the patients, there was a 92% patient acceptance rate of telehealth visits. They produced savings in patient travel. Some of the patients to go to this children's hospital were going to have to travel distances of up to 5 hours to receive care. And lastly, they saw improved clinic efficiency and a reduction in the number of no-shows. So again, these are, for the diabetes, it was more focused on, some of the clinical, as well as some cost savings. This is kind of, travel reduction, as well as improving, patient satisfaction and clinic efficiency. So if either of those are of interest, here are 2 kind of examples of that. Moving on to an example looking at congestive heart failure, or CHF patients at the University of Pittsburgh Medical Center. They saw that members who were 65 and older who were enrolled were now 74% less likely to be readmitted to the hospital within 90 days of discharge. And so that's a huge reduction for this patient population. And additionally, they saw in general with their Medicare patients who were enrolled, 76% were less likely to be readmitted. Over 92% of patients were compliant with the program. And, the reason that's significant is a lot of times you'll hear, the Medicare patients or older patients may be less willing to engage with the technology. This is an example of, they had very strong engagement in the program. Now looking at, this is where a RPM and CCM solution was implemented together. So where they had both services available to patients. And this is an example from the Patient Provider Telehealth Network in North Carolina, where they found by implementing both of the services that they reported an increased access to information for providers that helped improve decision-making. We'll go through some different quotes that some of their patients or providers gave with their program here in just a moment. They saw that it facilitated patient engagement and access to care, which resulted in improved self-management of chronic disease. And they reported significant improvements in health outcomes and reductions in hospital-related costs. And so these are just a couple of quotes. I won't read these verbatim from some patients and a provider from this network. And really in this first quote here, they're kind of talking about how they were initially intimidated by the technology. However, once they utilized it and they saw how their decisions ultimately impacted their health, it really helped that particular patient understand how they can make better health decisions in order to make sure that they were feeling their best and improving their health long term. Another patient also said that it changed their relationship with their doctor. It felt like they didn't have to do all this information gathering. They already had the data ready and available whenever that patient came in for that appointment or that telehealth appointment. And then lastly, from a provider's perspective, they were commenting on how it helped to really provide that education to patients as they were able to sit down with patients, ask them questions about, hey, what did you eat that day? How did that impact your blood pressure, as an example? You have very concrete examples that you can use to help educate that patient. So that's just an example of, utilizing some of that chronic care management and RPM services together with some patient and provider feedback. But CCM also had a large study that was done by the Center for Medicare and Medicaid Services, where they conducted a retrospective analysis in 2017 of over 2 years worth of claims data for patients and CCM programs. And they found significant cost savings for those patients who engaged. So for patients who were enrolled for 12 months or less, they saw that they saved about $11.48 per patient per month. And if that patient was engaged for longer than 12 months, they saw there was even more significant savings of around $30.34 per patient per month. Additionally, they saw with those patients who were engaged in CCM that they had a reduction in hospitalizations of about 4.7%, as well as a slight reduction in ED visits, which were reduced by 2.3%. So hopefully that gives a few kind of case study examples of, how CCM and RPM are being applied. But really, when it comes to patient benefits of receiving the services, we've talked about some of them already, but it really helps to reduce some of the travel time, especially, regardless if you're working in a rural or an urban setting, transportation barriers may be a huge problem for the patients that you're engaging. So really being able to, reduce their need for relying on transportation to receive some of those consistent check-ins for RPM and CCM is a huge benefit to patients, as well as reducing potential wait times. When you're working with patients who perhaps have a hard time getting time off of work to come in and see a provider, any reduced wait times that you can offer to patients is always going to be a huge benefit, as well as the benefit of being able to do it in the comfort of their own home, making it easier to fit into their schedule, and potentially improve, because some of those barriers have been removed for the patient, increasing the overall engagement from that patient to where they can engage and follow up with care more frequently. Now, I wanted to spend some time talking about specific benefits for maternal health. And I want to preface, so for remote patient monitoring specifically, there's not been a ton of empirical longitudinal studies specific to remote patient monitoring. It's still a bit of an emerging technology. That's not to say that there's no research that exists. I have several, sources on the slide after this of different studies that have been done. However, it's maybe not the most exhaustive, list of research studies that you could find. But really, here are some of the preliminary results of, what are some of the benefits when you're working with patients from a maternal health perspective when they're engaged in a remote patient monitoring or chronic care management program. And one of the biggest benefits is improved engagement and a potential for a greater frequency of follow-up for women who are experiencing postpartum depression, gestational diabetes, hypertension, and preeclampsia. So by being able to have that consistent data feed to where you can consistently monitor that patient's blood pressure, their weight, their diabetes, that helps you identify some of those issues maybe further on before they worsen, to improve the care that you're providing for those patients, as well as, the increased frequency of the check-ins could help identify some of the early flags for any postpartum depression for any patients that are being treated. So those are a few benefits of being able to provide a more convenient, way to engage with patients from maternal health, and increasing the follow-up that those women are having. And so those are a few things that are huge benefits by being able to provide these types of services for maternal health. Additionally, that improved engagement has the potential to reduce postpartum readmissions and costs. If you're able to earlier identify some of the signs for postpartum depression, hopefully that means that you can avoid any admissions that would happen as a result of that. It can also help reduce racial disparities and social determinants of health and maternal morbidity and mortality. I talked a little bit about, travel and transportation barriers can be a huge problem for individuals to be able to receive consistent care. And so RPM and CCM services can help reduce some of that burden and improve opportunities for those patients who are maybe struggling with those particular issues, as well as, reducing the potential for racial bias when collecting that biometric information by being able to utilize a remote patient monitoring platform where that data is automatically being recorded and stored. Additionally, it can help improve follow-up on well women's exams and increase or improve the ability for family planning and preconception care by improving the overall engagement with the patient. So those are just a few examples. This is just a list of, some different articles or research that's been done specific to remote patient monitoring or chronic care management that you can reference if you're interested. This is not exhaustive. However, as I mentioned before, there's not necessarily an exhaustive amount on these particular services yet, as they still are a little bit more of an emerging technology when it comes to the applications. Now, however, we have seen the biggest use cases for remote patient monitoring specifically during the course of the pandemic. So where the research may have been limited in the past, I imagine here in the next few years, we're going to see an explosion in the amount of resources that are available for remote patient monitoring programs that were able to first be implemented during the course of the pandemic, and some of those initial findings as well. So I want to look at next, looking at technology and capabilities. So when it comes to remote patient monitoring, and I'll also talk about, for a lot of these services, you're going to have to either work with a vendor in some capacity. The capacity that you'd have to work with them may change based off of your organizational capabilities or needs. However, I want to do a brief overview of what are some of the typical things that are involved with that. When it comes to a best practice for remote patient monitoring and device requirements, one thing to keep in mind is that you want to make sure that the device meets the FDA's definition of a medical device. This is described specifically in the 201H of the Federal Food, Drug, and Cosmetic Act. That is just going to make sure that if you're engaging with patients with remote patient monitoring, that's just going to be a best practice to ensure that the device that you're using is the best that you can provide. Additionally, if the device can automatically upload patient data, and depending on the payer, that may be a requirement, that's going to improve the reliability of the data. There are some remote patient monitoring platforms, perhaps where you have to have the patient enter in that data. That's fine, and that works if that's the only option that you have to engage. However, if a patient's entering that data, that does improve the risk of the data being entered incorrectly or having other issues with the data whenever you're looking to analyze and collect it. So when it comes to remote patient monitoring options, there are a few different options that you can work with. Some will offer it through personalized home kits and health kits. So I'll walk through a few examples of that, but perhaps a patient comes in, they're enrolled in a remote patient monitoring program. This would be a kit that would be sent home with the patient that perhaps includes some of these peripheral devices that you'll see here in the bottom left, such as a weight scale, a blood pressure cuff, a pulse oximeter, spirometer, stethoscope, wearables, or a glucometer, based off of the particular condition that that provider is wanting to measure and track. And so, it's always going to be personalized based off of the patient. If you are engaging with a patient for congestive heart failure, perhaps you want to send home a weight scale and a blood pressure cuff. And so those just give an opportunity to send those kits home with patients so that it's easily being provided there. Additionally, there are some programs that may, offer it through a mobile application. So you bring your own device. So perhaps it's a platform that's on an app that's downloaded on a smartphone or a tablet that is going to link up to those peripheral devices, typically by Bluetooth, to be able to collect and store that information. So there's pros and cons to both. The personalized home kits and health kits, they may include a tablet. That is a benefit, specifically if you're working with patient populations where perhaps technology access or technology literacy may be low because you're providing the equipment for them. So you're making sure they have the access to it, especially if perhaps they don't have a smartphone or a tablet they can utilize. The issue with that is, of course, that's going to cost more than a mobile application where a patient can, utilize their own device. So typically, a lot of times for RPM programs, you'll see some sort of combination of both. With patients who have the capability, they have, internet access at home, and perhaps they have a smartphone or a tablet they can utilize. Those patients are enrolled more into the mobile application. But for the patients who are enrolled in the program who perhaps don't have internet access at home or a smartphone and or a tablet, perhaps those are the ones that will receive the personalized home kits and health kits. Additionally, there are interactive voice response options for remote patient monitoring. And so that's where a patient would be able to verbally say what their measurement was for a particular reading. And so that is an additional option, especially if you're working with patients who may have a disability. That can be one way that they can still interact with the program by utilizing the interactive voice response for remote patient monitoring. Now, here's a few different examples for home kits. Again, we are vendor agnostic. We're not openly endorsing any of these vendors. This is for demonstration purposes. But you can see here, one of the kits here, this is actually more of what maybe perhaps a traveling nurse or provider who's maybe doing a home visit and doing some of these visits may bring with them. But you can see here, it has a tablet and it has multiple different pockets for some of those peripheral devices for that provider to be able to utilize. The two examples on the right are more examples of what perhaps would be sent home with a patient. So it's just a little kit that includes the peripheral devices that are appropriate for the particular program that patient is being engaged in and a tablet. And so those are just a couple examples of the home kits and perhaps what can be utilized if you're working with home kits for your patients. But when it comes to vendor options, there's a lot of options out there for remote patient monitoring for the same reason that we've seen an explosion in the amount of telehealth vendors that have entered into the market during the COVID-19 pandemic. We have seen the same trend for remote patient monitoring. So there are a lot of options out there. And we'll talk a little bit about how do you evaluate some of the options, but in general, if you're going to engage with a remote patient monitoring program and you're going to need to engage with a vendor for either the devices, for the platform, whatever piece you need to engage with a vendor on, here are just a general breakdown of what some of the typical capabilities are. And so for a remote patient monitoring program, one of the most common capabilities is going to be clinical alerts. And so this is going to be, you have patients who are enrolled in the program, they're sending data. Perhaps you're working with patients who, have gestational diabetes and you're monitoring their A1C. You can set a certain threshold of, for patients, I want to know if their A1C grows above X level. And that would, when you typically for these vendors, they'll have a dashboard that you'll have all the patients who are engaged in the program. And basically what that will do is for those patients who perhaps have a A1C recording that's in that concerning range, that will move that patient to the top of your list on your dashboard, as well as send you some sort of alert that X patient had a recording. This was the amount, this is the concerning that, or this falls within the range that you wanted to monitor. So that's a pretty common capability. So that way you can, focus more on the patients who are having some of those more concerning biometric values versus having to filter and sort through all of that on your own. Additionally, with those clinical alerts, it's going to come with reporting capabilities. So you can slice and dice the data however you would like. Some RPM vendors will help with some of the logistics and in-home kit delivery and installation. So if you are doing home kits, sending those home with patients, and perhaps you're concerned with that patient being able to set up the equipment on their own, and you don't feel like a handout or some in-person training is going to be sufficient enough to equip that patient, some RPM vendors will actually help with a in-home kit installation. So that's where they'll go to the patient's home, help them set up the equipment, and help with some of the logistics when it comes to making sure the devices are delivered and tracking and all of those things. Additionally, with remote patient monitoring, when we get to the billing section, tracking time is going to be an important part for billing. A lot of times, a lot of the RPM vendors will help track that for you. And so that way, when you're engaging with a patient, you're not manually doing that. There's some tracking mechanism that's already involved. And then lastly, some RPM vendors, not all of them, will actually help with some billing support. So if you're starting a new RPM program, you've never done it before, your billing team isn't familiar on how to bill for RPM services, some vendors can actually help with some of that billing support. So some of these are standard, such as the clinical alerts and reporting and time tracking. Some of these are maybe some additional things that could be added on that you might look out for if those things are important for your organization to be able to offer those services. But typically, if you're working with an RPM vendor, you're looking for clinical alerts, reporting, and time tracking as some of the basic capabilities that they can offer. CCM is going to be similar, but there's going to be a few different nuances to it. So you'll see here, clinical alerts are going to be the same. If you're looking to offer both services, ideally find a vendor that is capable of providing both remote patient monitoring and chronic care management services. That way you're not working with two different platforms, two different vendors to provide these services. You can combine the dashboards into one. That's going to make it a lot easier for you as an organization to be able to provide both services at the same time, ideally. So if you are maybe perhaps you start with remote patient monitoring, but you think you might move into chronic care management in the future, maybe pick a vendor that you can scale into those services at some point. If you feel like you have no interest in offering one service over the other, that may be less important. But I do want to mention that specifically. The main delineation is going to be the risk stratification. So for CCM vendors, some will be able to help you with, there are certain requirements in order to furnish and bill for CCM services. And so risk stratification is important to help identify the patients who are first eligible to be engaged in CCM services and to bill for it. So that's going to be an important piece. And, similar, some are going to be able to offer some billing support. Time tracking is going to be relatively standard. But for CCM, some vendors will also be able to offer some nursing support. So perhaps you want to be able to offer the service. Your current nursing staff or providers don't have the capability to take on those additional services. So some do offer nursing support to be able to help offset for that. So that's some general, just kind of covering the basics of the technology and the capabilities when it comes to remote patient monitoring and chronic care management. And so hopefully that's helpful. As I forgot to mention this earlier, but please feel free. So this is done in webinar format. So if there's any questions that you have, please feel free to utilize the Q&A function. I'm happy to answer any questions either going through the presentation or at the end of this presentation. But feel free to drop any questions that you have in the Q&A, and I'll be happy to address those. So moving on to more of the reimbursement, as well as some resources for remote patient monitoring and chronic care management. And so really, as I mentioned before, for remote patient monitoring and chronic care management, the future is very bright. We're seeing a lot more utilization of the services, especially during the pandemic, to be able to offer these types of services to patients. And so we've seen a lot more positive movement when we look at, state Medicaid level reimbursement opportunities for remote patient monitoring and chronic care management. And so that's been a huge highlight for the pandemic for these services, as we've seen more and more payers who are providing reimbursement for the services long-term. And so when we look at the primary billing codes for remote patient monitoring, it's going to predominantly fall into these 5 codes. This isn't necessarily an exhaustive list. It's just meant to give you an idea of some of the coding with it. This does not include remote therapeutic monitoring. That's kind of a separate set of codes. As also what is being monitored is different. So I'm focusing on remote patient monitoring specifically here. But there's going to be these 5 codes. The first is going to be the 091, which is focused on the collection and interpretation of the physical data. The 453 is going to be the initial setup and patient education on use of the equipment. An important thing to note on that particular CPT code is that can only be billed once per episode, predominantly, since it's an initial setup and patient education. That's not something you bill on a monthly basis. And then you're going to have the 454, which is the device supply with daily recordings or programmed alerts each 30 days. The 457, which is going to be the 20 minutes or more of clinical staff, physician, or other qualified healthcare professional time. And then the 458, which is going to be a billing code that you utilize for any additional 20 minutes off of that initial 457 code. So just some general takeaways when it comes to remote patient monitoring is this is going to be for patients with acute conditions as well as chronic conditions. So as I made that distinction before, there's not some of those particular criteria when it comes to providing remote patient monitoring care for patients. You can use it for more acute conditions. One of the things to note is that you have to collect at least 16 days of data during a 30-day period to bill. And as I mentioned before, that initial setup can only be billed once per episode of care. Now, when it comes to Ohio Medicaid and remote patient monitoring billing, Ohio Medicaid does have reimbursement. And so remote patient monitoring actually falls under the umbrella of telehealth in the eyes of Ohio Medicaid. And so the list of codes that I mentioned before, all of those codes are listed on the primary billing codes for remote patient monitoring, except for the 99091, which that is the collection and interpretation of physiological data. That is not listed as a code from Ohio Medicaid that can be utilized. However, if you're working with a private payer, it may be a code that is utilized. And so that's one very positive note from Ohio Medicaid. You can utilize those codes for remote patient monitoring, furnish and bill. Remote patient monitoring, if you are a FQHC or an RHC, it will be paid through the fee for service as a covered non-FQHC RHC service under the clinic provider type 50, which this is using the ODM's payment schedule. So there are opportunities for billing for FQHCs and RHCs specifically as well. I included a link for the telehealth billing guidelines, where if you want to dive into some more specific information, that's going to be the best resource for you to be able to dive into that specifically. I wanted to highlight just some general telehealth billing requirements when it comes to Ohio Medicaid, just for your information, in case this is perhaps new to you, but when it comes to, billing for the provider type, you're going to have your claim type is always going to be a professional. You're going to utilize your procedure code, CPT code for the service delivered via telehealth. And you're going to utilize the GT modifier as well as any other required modifier based on the provider contract, as well as a modifier for patient location if applicable. On the next slide, we'll talk about some of the different patient locations. And then when you are looking at the place of service code, that is based off of the physical location of the practitioner when the service was delivered. For FQHCs and RHCs, it's going to mirror almost exactly, except for the procedure code, where the first detail line is going to include the T code T1015, the encounter code, and the appropriate U modifier. So the main difference is if you're an FQHC and RHC, it's going to be that procedure code line. Most of the other things are going to follow similar when it comes to billing for telehealth for Ohio Medicaid. So patient location modifiers. So you're going to have these modifiers that are listed here. The patient home or place of residence at the time of service is a modifier that can be utilized. So this includes a homeless shelter, residential facility, other than a nursing facility, temporary housing. And as you can see here, a variety of other, so school, inpatient hospital, outpatient hospital, nursing facility, or intermediate care facility for individuals with intellectual disabilities. So these are all the patient location modifiers that can be utilized if you're billing for telehealth services through Ohio Medicaid. Now, I wanted to use this as a reference, and I will mention, so these particular reimbursements rates are coming for Medicare specifically. For Medicaid, it's, finding some of those specific amounts weren't as easy to find. But when it comes to Medicare, I wanted to be able to show you what some of the general reimbursement looks like, just so you have some idea. So for Ohio Medicaid, these rates will look different. And so I do want to preface that, but did want to give you some sort of idea of what some of the payment looks like for this. And so this is more for your reference. I won't go through, each of these lines specifically, but these are some of the current reimbursement rates for remote patient monitoring when it comes to Medicare. And so for Ohio Medicaid, those rates will look a little bit different. So when it comes to commercial coverage on a state-by-state basis, when it comes to private insurers, and if they are required to provide coverage of remote patient monitoring, at this point, currently in the state of Ohio, that is not a requirement. So if you are implementing a remote patient monitoring program, or, and this also applies for chronic care management, you plan to work with a lot of private or commercial coverage, you may want to check what some of the coverage looks like for those payers before you implement a program, if that's going to be a large percentage of your payer mix. And so, as I mentioned already with Medicaid, there's reimbursement for it. So if you have a high concentration of Medicaid patients that you're seeing, there's going to be lots of opportunity. However, with commercial, because it can vary so much between payer to payer and from state to state, you may want to check with some of those individual employer health plans or commercial private payers to ensure what the reimbursement landscape looks like for you for that specifically. When it comes to remote patient monitoring resources, if you're looking for policy updates or guidance for any of the services, one of the first is looking at the Center for Connected Health Policy. They are a national telehealth resource center that we work with that is focused specifically on policy. And so they provide policy updates as well as Medicaid guidance. Foley and Lardner LLP is actually a law firm that focuses on digital health. And so a lot of times they will post different policy updates, FAQs, as well as billing questions that people may have for remote patient monitoring. And as well as one of our sister telehealth resource centers, which is the Mid-Atlantic Telehealth Resource Center, provides a RPM toolkit, which really gives a guidance from searching for how to implement an RPM program to the whole implementation of an RPM program, kind of from nuts to bolts types of information if you're looking to start an RPM program as well. So those are just a few different resources that you can reference if you're interested and want to follow more specific updates for remote patient monitoring in the future. Now, moving on to chronic care management. So this does not include principal care management codes. This is looking at just chronic care management. And these are the typical codes that are going to be included with that particular reimbursement. So you're going to see the 99490, which is going to be, the 20 minutes of clinical staff time directed by a physician or other qualified healthcare professional per calendar month. The 491, the only difference is going to be at least 30 minutes of time. And so those are going to be the non-complex codes, which I'll walk through the differentiation between the non-complex and the complex. For the complex codes, that's where it's going to move into 60 minutes of clinical staff time. And the 489 is going to be any additional 30 minutes on top of that 60 minutes that's being provided to a patient. Now, when it comes to Ohio Medicaid specifically, those were a list of services that are typical for chronic care management that may still apply if you're working with private payers. However, there's no longer payment for the 99490 code, which is this first code listed on this page when it comes to Ohio Medicaid. Ohio Medicaid now will have you bill G0511, and they did actually have a particular reimbursement rate of $47.37 as the current maximum payment amount for that particular service. The complex codes that I mentioned, the 99487 and 99489, those come as bundled procedures with no separate payment. And additionally, for Ohio Medicaid, there are no place of service restrictions when you're providing chronic care management services. I included two examples at the bottom if you want to look at some more detail specific to chronic care management for Ohio Medicaid. And those are just as a reference for you. But when it comes to takeaways on what some of the differentiation between non-complex and complex codes is, the general baseline is that it does require 2 or more chronic conditions that are expected to last at least 12 months. And the conditions must place the patient at significant risk of death, acute exacerbation, decompensation, or functional decline. A comprehensive care plan must be established, implemented, revised, or monitored. So those are for the G0511, if it's for Ohio Medicaid, or the 99490, or the 99491 when it comes to billing for the non-complex codes. For the complex, it's going to include all the criteria of the non-complex codes, plus the following requirements. So either an establishment or a substantial revision of a complex care plan, moderate or high complexity medical decision-making, and then 60 minutes of clinical staff time directed by a physician or other qualified healthcare professional per calendar month. So those are some of the big distinctions between those particular code sets for chronic care management. Here again, I'm providing a table. This is, I did mention the one chronic care management code where a maximum payment amount was listed from Ohio Medicaid. This is some examples from the Medicare standpoint, just as a point of reference. And so Ohio Medicaids will likely defer, but this will help give some ballpark estimate of what some of the reimbursement may look like for chronic care management. And then here's again a list of resources. So Foley and Lardner is a big one, but CMS has a ton of resources for chronic care management services. And so a lot of these toolkits come directly from CMS. So they have a service fact sheet, FAQs about physician billing, as well as patient education resources, such as posters and postcards that can be used in a clinical or community setting. So these are just a list, if you're interested in chronic care management services, of some different places that you could look at updates or find additional resources from. So that kind of wraps up our overview of some of the reimbursement and resources for remote patient monitoring and chronic care management. Now, I want to talk about some best practices. So when you are looking to implement a chronic care management or a RPM program, as I mentioned when we were walking through the case studies, really know what your main pain points for your patient population may be, because you first want to identify a focus area. Usually the ways that you're going to do that is either by collecting, if you're an administrator, collecting patient and provider feedback. If you're a provider, helping collect some of that patient feedback on, what are some of the conditions that they would like to see a remote patient monitoring or a chronic care management program available for. Is there a patient demand? Is there a patient desire for it? If there's not, what are some of the barriers perhaps that they have to that? Are they, intimidated by engaging with the technology, or are they not interested in the service? What are some of those pieces? You want to have a solid focus area because you want to have a very specific focus on what you are targeting your program to, because that's going to really help you for the next point where you're prioritizing the problems identified. What are the biggest problems, and how does a remote patient monitoring or a chronic care management program help to address those problems? Because then you can look to envision the expected outcomes. As I mentioned, remote patient monitoring and chronic care management, there are a lot of case studies out there of some of the results that individuals have seen through implementing the programs. So you want to have realistic expectations of what are the outcomes that you can expect after you implement a program. So then lastly, you can evaluate. So especially if you are engaging with a vendor, but just in general, if you're creating a new remote patient monitoring or chronic care management program, you want to be able to evaluate, is it ultimately, having the expected outcomes? And if not, what are some of the things that need to change? So there needs to be some preliminary research done to make sure you're targeting your program appropriately. And then as well as some monitoring and evaluation on the back end to make sure that you are adjusting and making improvements along the way to make sure that it's bringing the expected outcomes. Now, when it comes to picking a vendor, if you do have to work with a vendor, this may vary depending on your organization's, culture, as well as your priorities, as well as maybe your comfortability with risk. So when it comes to one of the first questions that asks is, how long has the vendor been providing services? So if you are looking for a vendor that has a proven track record of doing RPM programs for a long period of time, as I mentioned, during the COVID-19 pandemic, there's been a huge upsurge of startups that are working in remote patient monitoring. What's your organization's preference? Do you want to work with more of a startup? Do you want to work with a more established organization? That's going to be one of the things that you want to evaluate on the front end to know what vendor may be a good fit for you. Second, you want to make sure each vendor may have a particular focus area or a particular service that they're offering to delineate themselves in a very crowded market. So you want to make sure their solution caters to your priority problems that you want to address. So you want to make sure that that vendor is ultimately going to be able to focus on the condition that you want to focus on. Ideally, if they have some notable case studies or they have experience working with clients in your area or similar demographics, that could be something important. So an example is perhaps you want to, if you're located in a rural or urban area, you want that particular vendor to have experience working with rural or urban patients somewhere in your geographic area. So that may be something that's important to you based off of the specific needs that you have in your community, that individual you're working with has some understanding of how to engage with that. And then lastly, what is the type of support you need and can they meet that need? So if you're new to remote patient monitoring, perhaps you really need that billing support. That may be a reason to work with a certain vendor if they can help offer some of those solutions for you, if that's something you really need. So identifying what are some of those big needs that you have, and how does that vendor meet with this? And this works, this is going to be a similar practice amongst remote patient monitoring and chronic care management vendors if you need to work with either to provide the service. And then lastly, with implementing a new service line or any virtual service at all, you really want to identify, is offering this program going to fit within our culture? So you really want to, again, do some of that preliminary work. You want to assess the service needs and define the environment. So what is the organization's willingness to engage in this new service line? Is there a particular condition that has become a significant problem for patients that you really want to address? And then additionally, you want to find a remote patient monitoring and or a chronic care management champion. So someone internal in the organization that understands the service, understands the need, and is really advocating for that program to move forward. And that's when you're going to move more into that development and planning stage, where you're looking at legal or regulatory constraints. You're creating a phased implementation approach, work plans, workflows, modifying any existing procedures to make sure that it fits and that you can provide the service. And then lastly, capability to implement and monitor. It's great if you can offer a service line, but you want to make sure that it's ultimately doing what you're planning it to do. So you want to test the platform with patients if you can, gather some baseline data so that you can see, this is what our patient populations looked like prior to our RPM and CCM program, and this is what they look like after, so that you can see some of the differences and the impact of the program that you're implementing, as well as always keeping tabs on patient volumes and utilization and outcomes so you can make adjustments as needed. And so I know I'm butting up close to time here, and so I want to make sure that I have some time here for any questions that you have. So if you have any questions, please feel free to utilize the Q&A function. I'm happy to answer any questions that you may have. If you have a more specific question you're not comfortable asking on the presentation today, my email is listed here. Please feel free to reach out to me over email. I'd be happy to assist you however I can. This slide deck will be made available to you at a later date. It will not be available immediately following this presentation, but will be available later on. And so you can utilize some of those resources and links that I included in this presentation in the future. But with that, I'll go ahead and pause for a moment here and see if there are any questions. I don't see any questions coming into the chat. So last thing I'll mention is, if you have just a moment here, I did include a link in the chat. We do like to collect feedback on our webinars to make sure that ultimately this is the type of content that you want to see. Get any ideas for any future content you would like to see in the future, as well as give you a chance, if you have any particular follow-up questions, to include it in the survey here. So I did drop it in the chat. You'll see it here. So if you don't mind just taking a moment to fill out that feedback survey, just so we can get some of that information from you. But really appreciate you all joining us today. Please don't hesitate if you have any additional questions in the future.